The first set of assessments that we are going to look at when looking at Chelsey is the static postural assessment. We are going to be examining her from an anterior, lateral, and posterior view. When examining the anterior view, you want to begin looking at the feet and ankles. When looking at the feet and ankles, you want to check to see if either of the foot's toes are pointed out or if the foot are flattened. When examining her from the anterior view, you see neither of the two in her foot or ankle. After the foot and ankle, you want to check the knees for valgus and varus. Again, we see neither of the two when looking at her from the anterior view. After examining the knees, we move up to the lumbopelvic hip complex. When examining the LPHC, we are looking to see if the pelvis levels with both posterior superior iliac spines and they are in the same transverse plane. When examining Chelsey, they seem to be even from the anterior view. After examining the lumbopelvic hip complex, we move up to the shoulders and the head. When examining Chelsey from the anterior view, you can see that her right shoulder is slightly elevated when you compare it to the left shoulder. Next, we are going to move over to the lateral view, where we are going to begin with the foot and ankle. In this area, you're checking to see if the knees are bending over the ankle and deviating from that 90-degree angle. Then you're going to check to see if the knees are either flexed or hyperextended. In both of these areas, she seems to be okay when standing in the static position. Next, we're going to move to the lumbopelvic hip complex and check for an anterior-posterior tilt. When examining Chelsey, you can see that she does have a slight anterior tilt. Next, for the lateral view, we're going to check to see if her shoulders are rounded and her head is tilted forward. Again, in this area, she seems to be okay when standing in the static position. Once the lateral view is complete, we move to the posterior view. Again, we are going to start at the foot and ankles. Here, we are checking to see for pronation or if their toes are pointed out. When looking at her right sandal, you can see that her right heel is lifted, causing pronation in her right foot. Next, you're going to move up to the knees to check to see for valgus and varus, and she seems to be okay in that area, again, when standing in the static position. Next, we are going to move up to the lumbopelvic hip complex. We're going to see if there is any rotation within the hips. From the posterior view, you can't really tell that she does have the anterior tilt. The last portion of the posterior view is to check to see if the shoulders or scapula are elevated and if her head is tilted or rotated. Similar to the anterior view, you can see that her right shoulder is slightly elevated. Next, we're moving to the overhead squat assessment. When completing the overhead squat assessment, you could see that her right foot is pointed out and there is valgus in the right knee. Next, we're moving to the lateral view of the overhead squat. Here you can see at the bottom of the squat that her lower back rounds. This is also known as a butt wink. After a couple reps, her shoulders do tend to fall forward, her right shoulder falling a little bit more forward than her left. Next, you're moving over to the posterior view of the overhead squat. Here you can see that she tries to adjust her feet to accommodate her weight coming down on the squat. her feet do flatten, and then again you see the right foot pushing outwards. There is also a weight shift when she goes down in the squat towards her right side. Next, we're moving over to the single leg squat assessment. When looking at her knees, you can see valgus in both her right and left knee. There is also a hip hike and an inward rotation of her trunk. Next, we're going to move over to the push-up assessment. Here you can see her scapula begin to wing after a couple sets, and then her head begins to drop into that forward position. Next, we're moving over to the pressing assessment. When looking at her from the anterior view, you can start to see the elevation of the right shoulder. She also is having to compensate a lot more by pressing the shoulder out of the normal movement pattern to get it on top. When viewing her from the lateral side, you can start to see the right shoulder fall forward and her head begin to move forward to help compensate to get the weight up. When doing the pulling assessment, you can see the same issue arise with her shoulder. As she tries to pull the weight closer to her, her right shoulder elevates. When we move to the left arm, we do not see as much shoulder elevation as we saw on the right side when doing the same assessment. During the horizontal abduction test, you start to see the right shoulder begin to drop and the shoulder on the left side begins to elevate. Once we got to the rotation test, she was unable to keep her arms at a 90-degree angle, and it was difficult for her to place her hands completely against the wall in either direction. Next, we have the gait treadmill walking test. Here we can see that her right foot points inward while she's walking, and there's an internal rotation of her right leg. The next test that we attempted was the upper extremity Davies test. From previous tests where we saw weakness in her shoulders, we can start to see her lose her stability the further along she goes into the test, almost losing complete balance throughout it. When reviewing the results of her test, I came to the conclusion that possible overactive muscles can include the gastrocnemius, the bicep femoris short head, the tensor fasciae lata, her adductor complex, her vastus lateralis, glute medius, glute maximus, and her piriformis. Here are examples of some lengthening exercises that can be done to assist with the tension in the overactive muscles. These exercises are going to help relieve tension from the tensor fasciae lata, the adductor complex, the piriformis, our gastrocnemius, our soleus, and our quadricep muscles. Next, we're going to start doing strengthening exercises to activate our underactive muscles. These exercises are going to help activate our glute medius, our glute maximus, lower and upper traps, abductors, and adductors of the opposite legs.